First, let's talk about what an acoustic neuroma is. An acoustic neuroma is a benign brain tumor on the hearing or balance nerve. It is a tumor not altogether rare, so there are many treatment options for it. It is benign but not harmless. Benign means that it doesn't grow very fast and doesn't spread, but it can certainly cause harm. This is a model of a skull, and the blue putty is what an acoustic neuroma usually looks like. Because the balance nerve, hearing nerve, and the nerve that moves the face all travel through here, problems with all these functions can affect the patient. The brainstem travels through right here, and big tumors can compress the brainstem and cause major neurological problems. So if the tumor is discovered when it is already very big, then it needs to be removed to decompress the brainstem. The three options for a patient when the tumor is discovered is watch and wait, surgical removal, and stereotactic radiosurgery. The watch and wait strategy is probably the most popular one for patients upon initial diagnosis. Most of the tumors are discovered when the patients have some hearing loss on one side, and the majority of these are found when the tumor is about 2 centimeters or less. The watch and wait strategy simply means that every 6 months or so, the patient gets an MRI and a hearing test, and intervention on the tumor is only done when there are changes detected by these tests. The philosophy behind this strategy is, hey, the tumor is not doing me too much harm right now, I want to leave it alone. The advantage of the strategy is that there are no treatment-related risks. However, it may not be a long-term viable strategy. For young patients especially, it's very likely the tumor will eventually grow to a size that causes significant problems. And the larger the tumor gets, the higher the treatment risks, no matter what treatment one elects. If watch and wait is the most conservative strategy, then surgical removal is the most aggressive. The philosophy behind this one is that, hey, I'm not getting any younger and the tumor is not getting any smaller, because the likelihood that I need treatment sometime in my lifetime is so high, and since surgical risks are higher when the tumor is bigger, I want this thing out of my head before it does me true harm. People rarely get healthier when they age, so the younger you are, the better your healing power is. Surgery, of course, has risks, but patients who elect surgery take on all the risks in one day, the day of the surgery, so that their future won't get destroyed by the tumor as it gets bigger. The advantage of surgery is, of course, the tumor is gone, and this could be a potential cure. And since surgical risks increase with the tumor size, operating right away is certainly minimizing the surgical risk. The disadvantage, of course, is all the surgical risks, which could include hearing loss, facial palsy, and neurological catastrophes. The final option for treatment is radiation, and here we are talking about stereotactic radiosurgery, a method of radiation which puts the radiation dose very precisely at the target with minimal spread of the radiation to surrounding structures. You might have heard of the CyberKnife or Gamma Knife, and these are machines that deliver stereotactic radiosurgery. Radiation is invisible, painless, non-invasive, but it doesn't get rid of the tumor. In fact, in most cases, it doesn't even shrink the tumor. What it does do is contain the tumor so it doesn't grow. For some people, this is sufficient, especially the elderly, or people with other health problems that may limit their lifespan or make surgery impossible. The advantage of radiation is quite obvious. It's invisible, non-invasive, bloodless, and the risk to the face is quite small, even though there's some risk to hearing. The problem is that it cannot be used on big tumors, and the containment on the tumor may not be sufficient for the patient's lifetime. What is the best treatment strategy for each individual patient? Well, it highly depends on the patient's symptoms, the size of the tumor, what the priorities are for the patient, whether it's hearing salvage, hearing preservation, or avoiding certain surgical risks, etc. So it is best that each individual discuss all this information with their surgeon.